Welcome back to our podcast series. I'm your host Usman, and today we are joined by Aksa, a passionate disability rights activist and advocate. Welcome, Aksa.
Thank you for having me. I'm glad we are discussing this critical issue. People with disabilities, especially women and girls, face excessively high rates of gender based violence, which increases their risk to HIV.
Let's start our discussion. Tell us, what is gender based violence?
Gender based violence means harmful acts directed at individuals based on their gender. It's rooted in unequal power dynamics and manifests in physical, sexual, emotional, and economic abuse. Examples include domestic violence, sexual assault, harassment, and forced marriage. For deaf youth, online violence and verbal abuse on social media are common forms.
Thanks for sharing your views. Now tell us, how does GBV intersect with disability and HIV in Pakistan?
People with disabilities, especially women, experience GBV at much higher rates. In Pakistan, 67% of women with disabilities have faced verbal abuse and 46% have experienced physical abuse, often inflicted by family members. This increases their risk of HIV due to sexual abuse, lack of access to protective measures, and limited sports services.
Do we have GBV in Pakistan?
Yes, in Pakistan, 28% of women aged 15 to 49 have experienced physical violence and 6% have faced sexual violence. Also, 34% of ever married women report spousal physical, sexual, and emotional violence. Alarmingly, 56% for survivors do not seek help due to socio cultural barriers and lack of accessible support services.
That's shocking. Can you please explain types of gender based violence?
Yes, gender based violence can be divided into five main types. First, physical violence, which refers to hurting someone's body through hitting, slapping, or using force. Second, sexual violence, like any unwanted sexual act like harassment, assault, or forcing someone without consent. Third, psychological violence, which means hurting someone emotionally through threats, insults, or controlling behavior. Fourth, socio-economic violence, which means denying access to money, education, or jobs to control someone's life. Fifth, harmful traditional practices, which refers to cultural acts like forced marriage or FGM that harm a person's rights and well being.
Thanks for the details. What specific challenges do people with disabilities face regarding GBV and HIV?
Challenges include social isolation, dependence on caregivers, who may also be abusers or societal attitudes, viewing them as easy targets. They often lack access to accessible healthcare, justice system, and education about their rights.
What can individuals and communities do to address GBV?
Education is key. Communities should challenge stereotypes, promote gender equality, and teach consent. Support services such as shelters and counseling are essential. Holding abusers accountable through effective legal frameworks is also critical.
Why is it important for deaf youths to learn about HIV and SRHR?
Deaf youth often lack access to accurate information, increasing their risk of HIV and STIs. Awareness empowers them to make informed decisions and take preventive measures. Vulnerable groups, including those of diverse genders, face higher risk due to neglect and stigma.
What challenges do people with disabilities face in getting tested for HIV?
Many testing centers are not accessible. There might be stairs, no interpreters, or health staff who don't know how to talk to someone with a disability. This can stop people from getting tested early.
What can be done to better protect individuals with disabilities from GBV and HIV?
Training and sensitizing healthcare providers, law enforcement, and communities to understand the unique use of people with disabilities is crucial. This includes trauma informed and accessible support services.
Those are excellent recommendations. Can you elaborate more on the specific interventions that could make a difference?
Absolutely. For example, we need to ensure that healthcare facilities have the necessary resources and training to provide accessible, disability inclusive GBV and HIV/AIDS services. This includes having sign language interpreters, braille materials, and staff who are knowledgeable and sensitized about the unique needs of people with different types of disabilities.
That's a crucial point. What other strategies would you suggest?
Empowering people with disabilities to advocate for their rights through peer education and support groups is vital. Accessible public awareness campaigns on GBV and HIV prevention are also necessary.
Thank you for sharing these insights. It's clear that a holistic, community driven approach is essential.
Thank you for having me. I look forward to continuing this conversation in future episodes.